In this video, I'm going to demonstrate how to do vital signs. Vital signs is a very important physical assessment to check a circulatory, respiratory, endocrine system effectiveness in the body. So right now I have a client I have to assess vital signs for, and she's been in the hospital for a day for pneumonia, and she has fever and a little bit cough, and she is currently on antibiotics. So the doctor want me to assess her vital signs and see the progress as compared to the baseline as she came in. Before I go into the client's room, I have to make sure all my vital signs equipment, my vital signs equipment are working properly and correctly. Okay. Hi. My name is Elizabeth, and I'll be your student nurse today. Can you tell me your name and your date of birth?
Sage Allen, 1/23/1996.
Okay. It looks like it matches with your wristband. Okay.
Okay.
Today I'll be performing a vital signs on you,
Okay.
and which includes your temperature, your oxygen, your blood pressure, your pulse, and I also have to assess your weight and your height.
Okay.
Do you have to use the bathroom today?
No, I'm okay.
Okay. Are you taking any medication like diuretic pills, like water pills, which might affect your weight? Do you?
No diet pills like that, just the antibiotic that I've
Okay,
been on.
all right. Can we step out so that I can check your weight
Yeah.
and height? Can you step on the scale for me? Okay. Your weight is around 100 and your weight is 150 pounds.
Okay.
Does it sound right?
Yeah.
Can you step down and turn around? Okay. All right. Okay. Your height is about 50 inches.
Okay.
All right. Can we go back to your room? Now I'm going to do your temperature. At this time, I'm going to assess if my client is sweating, and she's not sweating, and I check her ears. She doesn't have any ear infection or anything. So the best way to assess her temperature is using the tympanic machine. Okay. Okay. So Sage, I'm gonna put this in your ears, and it doesn't hurt or anything.
Okay.
Okay. I'm gonna pull your ears a little bit so that I can turn it on. Okay. Your temperature is 98.6 degrees Fahrenheit. Does it really run normal?
Yeah, that's a lot lower than yesterday, so that's good.
Oh, that's
It's
good.
back to normal.
Okay. Are you taking any antipyretic pills like Tylenol?
I was, yeah.
You are?
Mhm.
Okay, that's good. I'm glad it came
Yeah.
down. Okay. Okay, I'm gonna check your oxygen. Do you smoke or
No.
take tobacco? Okay, all right. So the oxygen will determine the amount of oxygen concentration in your blood, okay?
Okay.
Okay. Before I do that, I have to assess the warmness of the hand. Her hand is warm. She doesn't have any nail polish, nothing that will distract the reading. So I'll use the pulse oximeter, and I'll use the finger, the tip of her finger to do that. I'll turn over. Okay. Put it here. Okay. Your oxygen is 98%, which is very good. It's within the normal range, okay? Okay, right now I'm going to check your pulse. The pulse will determine how fast or how slow your heart is beating. Okay. Um, my client don't have any IV or any pacemaker or anything, so I can use either hand to assess the radial pulse. Okay, so I'm gonna locate the radial nerve right here, artery, sorry. Okay, your pulse is 60 beats per minute. Does it sound normal
Yeah.
to you? It does? Okay. And your respiration rate is 18 beats per minute, normal, and it's not pounding or anything. Okay. I'll go ahead and, for accuracy's sake, I'll go ahead and do the bilateral pulse also, if you don't mind. Okay, it read 68 beats per minute. Okay.
Okay.
All right. So I'm gonna go ahead and do the epical pulse. The epical pulse is an assessment to it's a pulse that we use to it's a skill that we use to assess the pulse of the heart, especially for clients on heart medication. Okay. Before I do that, I'll go ahead and clean my stethoscope. So what do you like to do in your free time?
I usually I'm in school, so I do school a lot. It's a lot of my time.
Oh, no.
Mhm.
I know it's important. I know it's hard, but it's worth it at the
Yeah,
end.
I hope so.
Okay. Throw this in the trash. Okay, so for the epical pulse, I have to identify the angle of Joules, which is normally the bone premised by the sternum, so right here, and then I'll have to identify the fifth intercostal rib, which is normally here. So I'm gonna count 1, 2, 3, 4, 5, and with the mid clavicle to locate the PMI is right under the breast, but because of educational purpose, I'll go ahead and take care of epical pulse right on the chest area, which I'm gonna set for 60 seconds. Okay. Your epical pulse also reaches 68 beats per minute,
Okay.
which actually conforms with both the bilateral and your radial pulse.
Good.
Okay. I'm going to do your blood pressure. Do you take any blood pressure pills?
No.
No. Do you mind if any hand that I use?
No, it doesn't matter.
Okay. All right. I'm gonna use your right hand. Okay.
Okay.
Okay, to do the blood pressure, I will have to identify the brachial artery, so which is right here, and 1.5 inches above it, I'm gonna place the blood pressure cuff. She doesn't have any skin issue, anything. So, how often do you do your blood pressure?
Not that often.
And if you do it, can you tell me your normal ranges?
It's normally 122 over 80.
Good. Do you mind if I hold it a little bit? Okay. blood pressure rate 122 over 74, which is good. It's within the normal range. It wasn't beating so fast. I mean, it was normal, okay? Um, is there anything else you want me to do for you?
I'm okay.
Okay. As the medical record indicates, you came here for pneumonia, right? My little advice I can give it to you is because the weather is getting cold, chilly now. Now, so I'll advise you to wear warmer clothes, and also you can do proper hand hygiene so that it can prevent infection of your lungs or anything. Okay.
Okay.
All right. Thank you for having me.
Thank you.
All right. Bye.
Bye.